Okay, we are doing the first step of our Aveli procedure, which is injecting the tumescent fluid, which is the numbing. We already did this side. You can see she's turning a little bit pale on this side. That means we did a good job. So the fluid does a couple things. One, it blocks those pain nerves. So she's only gonna feel tugging, pulling, and pressure, which is really awesome. But two, it helps get some of the blood out of the area so that one, the pain control can last much longer, but two, it helps prevent too much bruising. So I tell everybody the numbing takes the longest part. We're gonna just flood this whole area beneath all the markings where we're gonna be treating the cellulite, and then we'll come back with our Aveli device and be able to go in and release those bands, and she'll only feel that tugging. Just finished our numbing and we're about to start with the actual Aveli, but I love to let y'all see kind of an up close look at the device itself. This is a one-time use device. There's no capital equipment, super easy handheld device, totally cordless. It's got a little LED light here and then some buttons here. So it's got a little hook that we deploy like this. So we kind of get up underneath where we marked the cellulite dimples. We'll deploy the hook and pull back. That'll catch those fibrous bands that are causing the cellulite. Once we pull back, it will kind of recreate the dimple within those markings. If we're within the markings, then we know we need to release that band. So we'll let our little blade come out, we pull back, release that band. There's never just one, so we're gonna go right to left to release that whole dimple. And then the best part about Aveli is the verification, because we actually can control our results a little bit. So we'll go through with the hook and we'll slide through and just make sure that we're not catching any more bands, and we know that we did a good treatment. Okay, so we've got our Aveli device here. I can see where I'm at because of the LED light underneath the skin. We're up within one of the markings, so I'm gonna let the little hook come out, we'll pull back. You can see it's recreating that dimple within the marking. So I know that's a spot where I want to release bands. So we'll use our little blade, pull back. There's never just one. Remember, there's a whole web of bands underneath each dimple, and that's why things like diet and exercise and lotions and potions and all of the above can't do anything for cellulite. So we'll go through right to left, we'll release all of these dimples, and then here in just a second, we'll show you how we can come through and verify that we got them all. And honestly, all that she's feeling is some tugging, pulling, and pressure. So it's pretty amazing that we can make this super comfortable. Okay, I want to show you all the verification. This is how we know that we did a good job treating this band, or this actual whole dimple. So we've got our hook deployed. We want to be able to slide through just like that. It's just kind of slides through easy like butter. We're not catching any more bands, not recreating any more dimples. We know we did a good job. Okay, I want to go over a couple frequently asked questions that we get about Aveli. So one, it's a one-time treatment. We do it with you totally awake in the office, or it can be added onto your surgery. Like I said, very tolerable. We do that injectable numbing, so you really just feel tugging, pulling, and pressure. You will see, a lot of people ask, when will you see results? I take most of my after photos at 6 weeks. You know, once the bands are cut, they're essentially gone, but right after the treatment, you'll be a little bruised and swollen, and of course have all this marking on you. So between 4 and 6 weeks, you'll already be looking amazing. Honestly, even at the 2-week mark, you'll already see a huge difference, but you may still be a little bruised. And then speaking of bruising, let's talk a little bit about downtime. So really not a ton of downtime with this. You can sit on your booty, so it's not like a BBL, you can sit right on it. You'll drain a little bit from these little tiny baby incisions, only for a couple hours right after the procedure. We actually squeeze out as much of that numbing as we can. You will just have a little steri strip over this, so that'll fall off after a couple days. But we do have you avoid submerging, including baths, hot tubs, lakes, rivers, pools, literally everything except for a shower for about 2 weeks, just to let that little baby opening close. And then I'd like you to avoid working out for at least 3 or 4 days if you can, just because that can sometimes make bruising worse. And then typically my patients just take some extra strength Tylenol for discomfort. It's really not bad. I'll tell you, don't slam down on your booty, but as long as you sit nice and gently, honestly, you will tolerate it just fine. Okay, here's an up close look at an actual cellulite band here. This is what tethers the skin down and creates that dimple. There's always a whole web of these guys underneath each dimple. So it makes sense why diet and exercise and creams can't really cure your cellulite. You need something like Aveli to go in and release all these guys. All right, now we've finished the butt, we're working on the thigh. I love Aveli because you can treat cellulite in both the butt and the thigh, even the lateral thigh or the side of the thigh. So all from this one little incision. Sometimes if they're too far over this way, we'll make one extra little baby incision here on the side, but for her, we're gonna be able to reach them all from here. A lot of the dimples in the thigh are more of a line appearance, so we mark it just like it appears on your skin. And same thing here, we've got our light with our Aveli device going through, catch the dimple, you can see it kind of indenting right there. We know we're in the right spot. We'll use our little blade to pull through and release that band. Do the same thing right to left until we can do that verification and everything slides through nice and smooth.